the left is using this pandemic, they're using this crisis as a way to get their agenda in place. Look, they're open borders. They don't believe in immigration detention. And they're using this pandemic as a way to get to their agenda. And look, people need to understand, every time ICE puts somebody in detention, they already go through a series of reviews, including health. If there is an illegal alien that they want to put in detention, but there is a health issue that we can't properly take care of, then we won't detain them. If we can't take care of that person, we won't detain them, because we are responsible for the health and safety of everybody. So when this pandemic happened, no need to sue ICE to release aliens, because ICE already did a deep dive on everybody that had in detention. They looked at anybody at age 60 or over, even though the CDC and World Health Organization put the number at 65, ICE went to 60. Anybody above 60 with prior medical conditions that make them more susceptible to this disease or this virus, and if they weren't a public safety threat, they released them. ICE released, last count I knew, it was like 800 people out of the 32,000. So they've already done this as a matter of practice. And plus, you got our immigration health services. I see within ICE, there are doctors and nurses that have our medical program. They're used to dealing with infectious diseases. We deal all the time. Disease comes across that border all the time. I've had facilities shut down because of chickenpox or measles. We've had lice. We've had TB. And one thing that's important, a couple of years ago when I was ICE director, we had a case mark of someone that was arrested by the Border Patrol, a male that had a TB, had a strain of TB that was unrecognizable. And none of the current drugs could treat it. It wasn't effective. So we worked with the Department of Public Safety. We worked with the CDC trying to figure out what kind of cocktail can we give this person to address this strain of TB he had. After a couple months, we figured it out. But he stayed in detention for like 6 months while we treated him. Think for a moment, if he wouldn't have been arrested by the Border Patrol, we would have got into our cities and our towns. So we dealt with diseases all the time.